Healthcare is not a human right. Alright, strap in, motherfuckers. We're gonna get philosophical. This is gonna be a weird one, because it's not really an argument that can be made definitively either way. There's no, facts and data on this one, because in the end, it's a moral disagreement, but here goes anyway.
Actually, there is a fact. A fact is, there's nothing moral about force. You do not have a right over other people because they are not your slave. They don't work for you. They work for a wage. They work to make a living for themselves. Now, that doesn't mean to say that people, become doctors and they don't wish to help other people. Of course they do. But you do not have a right over another individual because you're not entitled to the life of another individual. You don't have an entitlement over the earnings of another individual. The earnings of another individual is their money. So you don't have an entitlement over that. You don't have a right over that. It's just like the argument over the whole thing to do with claiming that you have a right to a job. Well, how do you? Because to claim you have a right to a job is essentially to say that your so-called right to a job is greater than the right of the employer to disagree with you. See, that's the difference between negative rights and positive rights. Those of us who support capitalism believe in what you call negative rights because we are moral. That is to say, we believe in equal rights. That's right, we believe in real equality. Real equal rights is the right for each individual to freely agree to disagree with one another, and things are consensual. You socialists do not believe in anything voluntary. You don't believe in negative rights. You believe in force. In other words, you believe in stripping individuals of their rights and then claiming that your somehow entitlement, your so-called rights, are greater than the right of those who disagree. So even if someone disagrees, they're forced to pay for it anyway. They're forced to pay into the collective system for your so-called rights. You like to claim that you're all for equality, but you're not. You think that your so-called entitlement and rights are greater than that of the other individual who disagrees. Us who support capitalism, who support individualism and negative rights, look at things that individuals have the freedom to agree to disagree with one another, and things are done consensually. That's the first thing. And of course, the second thing goes on to the whole issue on the moral argument. In order to pay for a universal healthcare system, you need to strip individuals of their rights and force them into a collective group to pay for others. And the only way that you can do that is through government theft and violence. Now, you can sit there and laugh at this, you can sit there and screw your face up and make all the faces that you want, but the word consent comes into this. If you take from people without their consent, then that is theft. So yes, when it came to the income tax imposed in 1843, and you can look up the definition of the word impose, and you can see that it means relative to that of force. Since when was forcing people against their will something consensual or something moral? Since when was taking from people without their consent moral? Now, if you take something from people without their consent, that is what you call theft. You require the individual's consent. Did the individual consent to the government's taxation? No, they did not. No, they never. Just because you use something does not mean to say you support it. And just because you are using something doesn't change the very fact that it is still theft. Because if you're trying to argue otherwise, then of course people could just walk into your house and take whatever they want, because according to you that isn't theft. You don't have a right to food. You don't have a right to clothing. You cannot strip an individual of their rights and then say, well, this is a moral argument. Instead, healthcare should be down to that of helping people, but through a voluntary manner, not through the use of force. So you don't have a right to things like healthcare or education, or even claims over having a right to food, etc. And what does that even mean? Because even then you've got all different types of housing, all different types of food, all different types of clothing, etc, etc.
The fact that our Constitution has had to be amended 27 times, including 11 times within a decade of its original writing, shows that it isn't fucking perfect. These aren't laws of the universe. We can make whatever we want into a right, and we can define those rights however we want to as well. And the right to healthcare is enshrined in the UN's performative, obviously, but still nice Universal Declaration of Human Rights, so clearly some people believe that positive rights can be defined without overcomplication. And hey, if you want a good definition of how a positive human right should work, I've got a good one from my main man Carlos Marcus. From each according to his ability, to each according to his needs. Not necessarily in the communist sense, although, but in the sense that everyone should be provided what they need to live.
And there you have it. But Karl Marx didn't understand scarcity, did he? So for example, like Thomas Sowell's example of the beachfront housing. Let's say you've got 70 million people living on the island and there's only one beachfront. How then do you get to decide who lives in the beachfront housing? Because not everybody can live in them. There's only so much room available. There's only so much available land. There's a scarcity of land. And so since there's a scarcity of land, how then do you determine who gets to live in the beachfront houses? You can't have 70 million people living in them, so how then are you going to decide? Favouritism? And that's exactly what I mean, folk. These people are utterly clueless about scarcity. That is to say, they think they can defy the laws of supply and demand because they're stupid.
Let me read the part of the UN Declaration of Human Rights in question, because it covers a lot more than just health. Article 25, Section 1. Everyone has the right to a standard of living adequate for the health and well-being of themselves and of their family, including food, clothing, housing and medical care and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond their control.
Yeah, you wouldn't see a problem with the United Nations, the home of the one world government, the home of the very globalist elite aiming for a communist one world government, the very heart of the globalist elite who believe in socialist pish. Yeah, you wouldn't see a problem with them, but I do see a problem with them. I see a very serious problem with them. A problem where they believe in a world of collectivism with one world government and a one world currency, where they want to take control over the Earth's resources, all in the name of their socialist obsessed nonsense. Of course, you wouldn't acknowledge that fact.
Socialized medicine provides no incentive for people to be doctors/surgeons. This is a Ben Shapiro special. I'm just gonna play a clip, actually.
Basically, socialized medicine works the same way, except there is no upper echelon. They've made it equal at the expense of the upper echelon. Meaning that if you now want a surgery, you gotta wait 6 months online for it because we didn't give any incentive for people to become surgeons.
What an interesting argument that privatized healthcare markets incentivize more people to become surgeons. I wonder if with a 3-second Google search I could, oh hey look! It's a list of every country in the world ranked by surgical workforce per capita, and the United States is 50-fucking-3rd! We're behind fucking Turkmenistan! Fucking weird how those commies in Cuba have managed to incentivize their population to have twice as many surgeons per capita as we do.
There's plenty of doctors, but they earn nothing, so they're usually driving cabs instead of providing care.
Again, he bases this assumption on the state of the main American healthcare market, and this is where this is coming from. And he somehow thinks that the main American healthcare market is somehow free market, and it's not. It's a healthcare system that's faced with serious problems, and serious staff shortage problems. Let's take, for example, the main American healthcare market when it was faced with the Medical Association monopoly was a granted monopoly by the federal government, where they closed down at least 123 medical schools. So there's a severe shortage of people becoming medical doctors. There became a medical staff shortage problem, and the demand would far exceed that of the supply of medical doctors available, because over the same course of that century-long period, you would see a 284% increase of the US population. So of course you're going to have more people chasing medical treatment, and of course there's a shortage of medical staff available. So is it bloody any wonder why there's that serious problem, and even many medical doctors becoming stressed out because of the serious issues that they're faced with? That's why many of them left and went to the direct primary care model in the United States. Oh, what a bloody surprise. And that's why you've got to laugh at those type of people, because again, even when it comes to the NHS, The best doctors have been leaving the NHS for years. It's not the fault of, the doctors and nurses. They're not to blame for why the healthcare system is the way that it is. They do an amazing job for what they do, but unfortunate as it is to say, many of them are stressed out because of issues of just the failure of the healthcare system. It's one of these things where he tries to compare the main American healthcare market to that of the likes of the NHS, etc., which is a bloody joke.
There's no such thing as free healthcare. Someone's paying for it even if you're getting it for free. No shit! You figured it out, buddy! So, you know how insurance works? It's a collective of people paying into a system to cover costs of other people in the system when they need it, regardless of whether or not they use it.
And there you have it, regardless of whether they use it or not. So in other words, when they're not using it, they're forced to pay out, and it comes at a very heavy cost. Moral isn't forcing people into a collective group through economic enslavement and then kidding on that you're moral after forcing them. It's like sticking a gun to someone's head and then saying do it and then claiming that you're moral just because you helped another person.
But when someone has fire insurance, and they lose a bunch of shit in a fire, and the insurance pays for replacement stuff, no one says that they got free stuff. They used the insurance, and the insurance worked. The available money was used to pay for services for someone in need of them.
I don't think anybody that supports the free market model, such as what you see in the United States today with the direct primary care system, no one's arguing that insurance is a bad thing. There's a lot of unnecessary health insurance that's involved in the main American healthcare market. The free market argument is saying getting rid of, all the unnecessary insurance and having a more simplified model where you have insurance to afford, specific things. But that's not the case. When it comes to the whole issue on national insurance, you've basically driven people's cost of living through the roof, all in the name of paying for everybody's insurance.
The only reason we have to talk about Medicare for All providing free at point of service healthcare is because Americans are conditioned to think paying exorbitant amounts for healthcare services is normal.
And that's the reason why your entire argument has collapsed for universal healthcare. One, because your free healthcare here in Britain is far more expensive than a free market in healthcare. And number two, the United States main American healthcare market is not free market. In other words, if you had a free market healthcare system, it would give all those universal healthcare systems a showing up, not just for the sake of quality, but of course overall efficiency. And of course, you wouldn't have those long waiting lines. The market itself, through individual doctors and nurses, etc., they're the ones who understand healthcare best. The main American healthcare market is not free market, it's faced with a third-party payer system. It's a monopolised system, that's why it's exorbitant in terms of its costs. So you haven't got a leg to stand on to defend A, the universal healthcare system, which is a pile of shit, and B, that of the main American healthcare market, which is also a pile of shit. There you go.
Medicare is a terrible system, and expanding it to all American citizens would be a mistake. The name is actually a misnomer, as it would destroy Medicare. This is kind of an esoteric one, but I have heard people who are legitimately confused about this asking in good faith why we would want to expand Medicare like that, so figured it should be addressed. And yes, I did encounter a few conservatives framing their argument with this false equivalence as well. To make it simple, Medicare for All is a name that was selected kind of for optics reasons. It has literally nothing to do with the current system within American healthcare for those 65 and over. The reason why we say Medicare for All instead of just universal healthcare is because Medicare is the closest we actually have to a federal universal healthcare system in the United States, and it's the easiest thing that's currently in action we can point to for comparison. Medicare does have a whole lot of issues. I've linked a Knowing Better video that touches on the topic in the links if you're interested in hearing more. So I agree that just expanding the current Medicare program to cover all Americans would be a pretty terrible idea, because it would just exacerbate those issues. But Medicare for All, as I said at the start of the video, refers specifically to a single-payer plan free at point of service that will cover far more than current Medicare does.
No, it doesn't. And the reason why it doesn't is because you're going to destroy the information of profits and losses. Profits isn't just something you fill your pockets with as a means of a surplus. The ability to ration scarce resources, to ration scarcity. That's what profits do. Whereas you're going to remove that and you're going to be left with the very problem that Thomas Sowell had explained. You're going to be faced with a very extremely high demand. The doctors and nurses will not be able to cope with the level of demand because of the sheer scale, especially with a population of 300 million people in the United States. They're going to be left with a massive big long waiting line. How then do they ration scarcity without prices? People who otherwise didn't really need the healthcare treatment start taking advantage of it, and they start taking up doctors' valuable time. And that's again something that Thomas Sowell explains in his book Basic Economics. He explains how the quality of healthcare goes down. Prices enable you to prioritise to people with greater urgent needs. That's why profits and losses exist. Profits and losses exist for a variety of reasons, and that's one of the most important reasons, because what you see in the universal healthcare systems is many people neglected, just like the story that Thomas Sowell gave where a cancer patient was knocked back so many times simply because of the lack of the information of profits, etc. So a young girl seeking a boob job was being seen to first. But you don't understand that because you don't understand economics.
Universal healthcare systems mean that people are denied new technologies and treatments. I wavered on putting this one into the video because it's basically just a combination of several other bad arguments we've seen. This argument and several others like it are out there that are similar to everything we covered in the first segment on Canada and the UK. The other countries have this assortment of problems, therefore we would be exactly the same arguments. But the reasons why these treatments are often not given are funding issues, often because, over time, conservatives have made it more difficult to increase funding and expand access to treatments. It's the classic conservative play I mentioned earlier.
Lies, folk. It's not because of funding issues. The NHS has had billions poured into it for years, even during the period where they tried to claim there was underfunding of the NHS. It is all lies. Excuses, in other words. The very reason why it won't get the same technology is the same reason for why you saw outdated cars, which wasn't a fashion statement. The reason why they're driving about in 1950s motors in Cuba is because when you destroy the information of profits and losses, there is no possible way for you to technologically improve. You're faced with the knowledge problem, you're faced with the economic calculation problem. Again, if you don't understand the economic calculation problem, you can watch my videos on that. That's why you wouldn't be able to technologically improve. Anyway, folk, I think I've covered enough of these arguments, and I've covered about half of these video or whatever. All of these arguments are nonsensical. He really doesn't understand a single thing of what he's talking about. Remember, of course, you know, there's the censorship of my own comments and whatnot. He's never heard of direct primary care in his life. He probably assumes that the main American healthcare market's free market, and that's really all you have to understand. So folk, if you've got anything you'd like to ask, comment in the comment section below. Be sure to like the video, share the video and whatnot. And of course, thank you for watching. Right, cheers.